For about the past decade, the United States has been suffering from a shortage of registered nurses. This is projected to continue through upcoming years. In fact, the American Nurses Association predicts that by 2022, there will be more registered nurse positions available than any other profession. Along with that, the Bureau of Labor Statistics has projected that there's a need for 1.1 million new registered nurses in order to avoid this shortage. There are many reasons for the occurrence of the shortage, which we will touch on a few within this video, but we hope that you, as future nurses, can feel motivated to continue along the somewhat difficult path to becoming an RN, and that you can feel motivated to help our country avoid this shortage.
Okay, so the first thing we wanted to address is the increasing need for healthcare in regards to the nursing shortage. And one of the biggest things is COVID-19. So it's still somewhat too early to see the long-term effects of the COVID-19 pandemic on nursing employment, but we can make some assumptions already from what we know and what we've seen happen so far. And a research survey conducted in April of this year surveyed nurses in North Carolina and found that 67% of them were considering leaving their professions as a result of the COVID-19 pandemic. And we can just assume that at least some of those nurses did end up deciding to follow through with that and walk away from the nursing field, leaving a need for nurses to fill those positions. And this is also supported by the recent letter published by ANA, or the American Nursing Association, that basically just addressed this state of emergency that the country is in. It was addressed to the Secretary of the Department of State, and said that due to the pandemic, we are seeing a huge shortage of nursing. And then the last thing we wanted to mention was baby boomers. And so with the baby boomers and the older population, according to the Population Reference Bureau, they counted 65 million people aged 65 and over in the United States in just 2018. And so with advancing medical technology and with them living longer than they have in the past, it does require more care as they get older, and that does require nurses, once again contributing to that need for healthcare workers.
The American Association of Colleges of Nursing did a report on enrollment and graduation from nursing programs, which determined that 8,407 qualified nursing applicants were turned away last year from the programs due to insufficient faculty, clinical sites, classroom space, and funding. After all, it does take a nurse to train a nurse. This is where we face the dilemma. These experienced nurses have to make the difficult choice of choosing between being an active nurse or a nurse educator, as it seems that both are in high demand. In recent years, especially with COVID-19, the demand for nurses have gone up, and it has become more evident that we're in need for more nurses. With the nursing shortage, it is essential that there is more focus on expanding nursing programs at universities so we can push against this crisis.
When considering the effects of nursing shortage in the future, it's very easy to think that nurses have it all together and that they can handle the workload, but when units are short-staffed, then nurses end up taking on a lot more work and patient care than they are supposed to. And this can lead to a widespread phenomenon known as nursing burnout. This is when nurses and individuals become mentally and physically exhausted, and it can lead to a decreased quality of patient care.
When we think about quality of care in the healthcare system, we're not talking about the trivial issue of how kind a nurse was to you. We're talking about life and death. Bradley University recorded a 2 to 7% increase in mortality as a result of a shortage in nurses. One of the biggest problems seen is medication errors. According to Bradley University's surveys, close to half of all nurses surveyed have admitted to medication error in the last year. This could be anywhere from infusing medicine at the wrong rate to giving the wrong medicine. Chances are this high, it's no surprise that turnover rate is high as well, and that directly affects the patient-to-nurse ratio, which will continue to be a problem if nothing changes.
After all this, the future might seem a little bleak. But the truth is, every nurse makes a difference. We can make a difference. It's not going to be easy as we deal with an increasing demand of health care throughout the COVID-19 pandemic and as it continues, or the competition to get into nursing programs that aren't widely available throughout the USA. And also as we deal with the stress and pressure of so many patients and not enough nurses. But it will all be worth it. We have this incredibly unique opportunity to change lives. Now, we can't change the past, but we can start now to impact the future in ways that we can't even imagine.